We also have anatomy and physiology and pathology workshops where students are in smaller groups working through tasks in workbooks, etc. And as you've said, we have our clinical and communication skills sessions, and all of these things are happening every week. And they have relevance, or they have material in them which are directly relevant to the case that the students are learning and that system. So the hope is that when students are doing the problem-based learning, working together in groups, learning to work with each other in some cases, trying to use the case as a vehicle or a peg on which to hang their learning, they can bring the information that they're picking up from the lectures, from the clinical skills sessions, and put them all to good use in terms of learning what's important to know to understand the particular disease process or that system in that particular patient. And we know that the students do that because in PBL sessions they will often say, if we're getting them to take a mock history from the patient, for example, they'll often say, well, in clinical skills this week we were taught to structure it in this way, and one of the students will perhaps volunteer to have a go at taking the history. Their peers will pitch in and give them suggestions of where they could have done things slightly better. And what we see over the course of the first year and certainly into the second year of the course, the students become very practiced and capable of doing that. So we do think there are elements of the course which mesh together, dovetail together quite nicely, which seems to work for the students.